All right, Lagos. Indeed, it is time for us to talk about our health here on Smooth Health. This is Smooth 98.1, and every Thursday at 5:15, we get to talk about your health. The things that you probably you need assistance trying to understand, and that's why we get the doctors in. So it's not me just reading out or sharing things with you. No, no, no. The doctors get to give you insights. Also help to debunk all the myths that you've grown up learning. So we get to unlearn, relearn, and it's a continuous process. All right. So talking about health today, we'll be talking about heart health. You've heard about heart health. You've heard about what you need. You've had good cholesterol, bad cholesterol. What exactly is all that? Those are that's part of the conversation we'll be having today. And to be a part of Smooth Health, what you can do is if you have questions, you have contributions, things you've heard that you want debunked or you want confirmation on, well, the WhatsApp platform is available for you to share those thoughts and insights. 0911 999 0981 0911 That's the WhatsApp platform where you can share your thoughts, questions, contributions, and believe me, it is welcome. Thankfully, today on Smooth Health, like I said, we're talking about our heart health and cholesterol. That word cholesterol, when you just hear, you're like, dread, right? Oh my God, been there before. I always used to wonder, why is this thing such a big deal? Why are we always told there's good, there's bad? Are they even just, playing with our intelligence and all that? You get to ask these questions and it pops up from time to time because you hear, oh, it's this oil, don't eat this oil, eat this one is good for. What exactly does all that mean? Well, thankfully, we have in the studio with me, yes, Lagos, I have Dr. Francis Asogwa. He is the consultant cardiologist at um, Iwosan Lagoon Hospital. Good evening and good to have you with me.
Good evening. Thank you.
A pleasure, pleasure indeed. So, Lagos, it's time for us to get into those conversations that sometimes you feel a little hard. Maybe you probably thought about it, you've not been able to have access to asking a doctor. Well, that is why Dr. Francis is here to weigh in on the conversation and address it. But let's start with the basics, really. What exactly is cholesterol, and and why does it even matter for our heart health? I think we should start with that one first.
Yeah, thank you very much. Um, Cholesterol is a waxy, fat-like substance that our body produces from the liver,
Hmm.
and we can also eat them through animal-based diets. Okay, so they are like fats that flow in the bloodstream. We have cholesterol in the blood, and we have in the subcutaneous tissue. So that in the subcutaneous tissue can lead to obesity, or that's in the blood can clog the blood vessels and block the blood vessels, thereby causing heart disease. And so, because we are talking about the heart,
Right.
and the United Nations have dedicated September 29th of every year as
Mhm.
World Heart Day. So we are discussing about the heart and what affects the heart health. And so today, cholesterol affects the heart health, and that's why we are here today.
Thank you so much for at least explaining why that is even a thing, why we should be worried about our heart health. It's not just because we want to, as they say, talk, talk, talk. There's a reason behind the talk. And it is to understand why your heart health is important if you've been eating the right things. Yes, possibly we will talk about what's the word now? Oh, vegetables. Why doctors always say it's the rainbow. Yes, they always say it's the rainbow. Why is eating the rainbow of significance? We'll talk on all that as well. But talking about cholesterol in itself, we've often heard about good and bad cholesterol. Can you explain the difference between the HDL and LDL cholesterol in the way anyone, a layperson, can actually understand.
Yeah, so HDL and LDL cholesterol are two kinds of cholesterol that are produced in the liver. And so HDL simply means high density lipoprotein cholesterol, while the LDL is low density lipoprotein cholesterol. Okay, so cholesterol generally is good for the body. Okay, so but it has a range. So if it is beyond the range, it can start causing problem. And which of them causes problem? The LDL cholesterol. So it's known as the
Oh,
bad cholesterol.
okay.
And the reason why it is known as bad cholesterol is because when exceeds the normal level in the body, it begins to clog around the blood vessels leading to the heart. Not just to the heart, to other major organs like the brain. And so when they clog the blood vessel, they plaster on the wall of blood vessels, they form what we call plaques. So there's no enough space for blood to flow. So when there are
Mm,
no enough space for blood to flow, we will have ischemia, shortage of blood supply, and sometimes complete infarction. So this can lead to a heart attack or a stroke. So that's what the bad cholesterol does, the LDL cholesterol. But the good cholesterol,
right.
which is the HDL cholesterol,
Mhm.
is a kind of cholesterol that stands as a police in your bloodstream. So the liver also produces it. So whenever the cholesterol exceeds the limit, the good cholesterol will begin to collect the excesses back to the liver for excretion. That's why it is called good cholesterol. So it protects the heart, protects the brain, protects the major organs. So it takes back cholesterol, excess cholesterol to the liver for excretion. So we call it a cardiac friendly cholesterol. So in some people, they have low HDL and high LDL. So that's a risk for stroke and it's a risk for heart attack. But when you have the reverse, low LDL and high HDL, then you you are safe. Your heart is safe, your liver, your kidneys, and your brain, everywhere is safe. Okay, so that's the difference between
HDL.
HDL and LDL, the good and the bad.
Hmm. All right. Let's just take this message that's popped up. Well, this is definitely something that Lagos would want to get insight on. I know that Wale shared this a few minutes ago. Same thing. Thank you so much for sharing, Wale and Otumayemi Giwa. Just wanted to share that a trailer carrying plywood has collapsed on the Ujuelegba Bridge. Aside the contents, the truck overturned and sadly, upturned, and there are supposedly there are vehicles underneath that container. If you are within the Ojuelegba axis, please, if you have other alternate routes you can ply at this moment, please do so. It's causing some serious traffic and holdup around that axis. Inside, you can find your way or maneuver your way around the Eric Moore axis as well as other, yeah, axis within that. It's actually going to take a while to resolve, and I hope that the emergency services are also following suit and trying to be on top of that very sad situation there. I wonder sometimes um, when it comes to all this trucks and proper management. But just needed to share that news that is worth having to share. All right, very sad one, but let's continue as we progress. I'm talking about good cholesterol, talking about our health, and talking about how we need to be in tip-top shape. Well, Nigeria has been reported to have a rising burden of heart diseases right now. World Health Organization has noted that cardiovascular disease is one of the top causes of death globally. So my question really is, why should Nigerians even be paying more than unusual attention to their cholesterol right now?
Yeah, thank you. Like you rightly said, WHO has noted that cardiovascular disease is one of the top cause of death globally. And for us to know the implication of what cholesterol can do to the heart, very briefly, I just want to give you a description of how the heart works. Okay, so just imagine your heart like a house. Okay, so the house has a wall, has a roof, has doors and windows, and have pipes that go through the walls that supply water to the building. Okay, so what happens is that the pipes that supply water to the building can be blocked. And once it blocks, that part of the wall where the blockage is will start leaking. And before you know it, the place will be discolored. So that's what happened in the heart. The pipes in the heart is the coronary arteries. Those are the arteries that take blood to the heart. And so this pipe can block.
Mm-hmm.
And so when the pipe blocks, you have three major arteries in the heart. Okay, three major coronary arteries. Any of them, one or two or the three of them can be blocked. And if any is blocked, one is said to have had a heart attack. So because that area of the heart that that particular blocked artery supplies will just go numb. And so the heart is meant to be contracting for the rest of his life, just contracting. So when there's a blockage in any of the arteries to the heart, the place that aspect of the heart goes numb. And when it's numb, the heart cannot pump. The person collapses, complain of a chest pain, and collapses. That's why you see, do a CPR. The CPR, the essence of the CPR is to stimulate that part of the heart that is going numb. If it's not done within few seconds, few minutes, the person can die. And so what causes that blockage?
Right.
The principal culprit is cholesterol. And so that's why it's very important. If WHO says ischemic heart diseases, that is heart attack, is the leading cause of death, and we now know today that the primary cause of that blockage in the vessels in the heart is accumulation of cholesterol. So there can be no better time to discuss about heart diseases with cholesterol rather than now. And so we are telling everybody to be careful because this cholesterol is both produced in the liver and consumed through diet. So the choices we make through the diets that we take can lead to accumulation of this cholesterol in our blood, especially the bad cholesterol, the LDL cholesterol. And once it's accumulated, it can cause blockage. And with blockage, it can cause a heart attack. You know, just like we see recently in Lagos, there are flooding everywhere.
Right.
Part of the cause of flooding is blockage in drainage. So we are talking about blockage in the drainage of the heart. So cholesterol causes blockage in the drainage of the heart. And once there's a blockage, it affects the heart. Once it affects the heart, one will have a heart attack. So that's what we call a heart attack, accumulation of cholesterol in the coronary artery. So the reason why we need to control cholesterol cannot be overemphasized because we know the danger to the heart.
Thank you so much, Dr. Francis, for explaining that in the easiest of terms for anyone listening to understand why when they say it's a heart attack, you now get it. Just as you have those blockages when they keep telling you, do not block the drainage, do not block the drainage. You get floodings. Same way you do not want your heart to, or the arteries rather, to be blocked. Once those are blocked, it's just a slim chance that you could still be alive. Well, we'll take a quick breather. When we get back in, we'll continue the conversation and talk more about what you need to do. Sometimes your diet, yes, I know that Dr. Francis has touched a bit on the diet. What is that thing you're eating that you're not conscious of? Or what is the thing that you're eating that you're conscious of as well? And you know you shouldn't be eating. We'll talk about all that on the other side. Lagos, the Motor Muscle, stay tuned to Smooth 98.1.
This is Smooth Health on the Drive. In the cooking game, you need a winning game plan. I'm not just talking about your fresh ingredients, utensils, or cooking skills. I'm talking about your choice of seasoning. My game plan is incomplete without Maggi chicken flavor, made with a flavorful formation of onions, celery, turmeric, it's my game changer. Elevate the taste of your everyday dishes with delicious rich chicken flavor. Oh yeah, let's go. New Maggi chicken flavor, my game changer. This is Smooth Health on the Drive. This is Smooth Health on the Drive.
All right, Lagos, 32 minutes gone past 5. You are tuned in to Smooth Health here on Smooth 98.1. And today on Smooth Health, we're talking about your heart health as well as cholesterol. We've heard a lot about cholesterol. Why is it even important? Thankfully, we have Dr. Francis Asogwa. He is a consultant cardiologist at Iwosan Lagoon Hospital, and he's been giving great insight as to why you need to understand what HDL is, which is the good cholesterol, and LDL, which is the bad cholesterol. In case you're wondering, well, there's so much reasons as to why you need to avoid certain things. And talking about that, some people think that cholesterol is only a problem for older adults. That is why they get to eat a lot of fried foods, eat junk, and so on and so forth. With that, I'd like to ask, can young people also be at high risk of cholesterol or heart problems?
Yes. So high cholesterol cuts across all ages. In fact, we have what we call familial hypercholesterolemia. What that simply means is high cholesterol that one is born with. So
Oh,
yes, so one can be born with high cholesterol. So you see a
okay.
child, very young child, you start having, symptoms. We'll see some cholesterol deposits around the knuckles, around the the elbow joint, at
Ooh.
the ankle, what we call xanthomas. So these are signs for us that one could be having familiar hypercholesterolemia. So that's one, it can be familiar. Then acquired is what we eat. So cholesterol
Mm.
plaques start building in the vessel. So it's not a one-day thing. Like
Right.
I use the anecdote of the flooding that just happened recently. So it's
Right.
not a one-day clogging of the drainage system that caused that flooding blockage in the drainage system. It's a continuous thing. And for us to have total blockage in the coronary arteries, it will take at least a period of 5 to 10 years of accumulation of cholesterol. So it will just keep accumulating. So it starts accumulating from childhood. So for someone who doesn't have familial hypercholesterolemia, but have dietary indiscretion, what I mean
Mm.
by that is you eat without looking at the content of what you eat, especially those that indulge so much in fast food,
Hmm.
you know, baked food, eat a lot of meats, especially red meat. So red meat contain high level of cholesterol. Animal protein generally contain high level of cholesterol. It could be ram, it could be goat meat, it could be cow meat, it could be pork. They all contain high level of cholesterol. Alcohol as well contain very high level of cholesterol, especially when you drink out of moderation. So it can accumulate cholesterol in the system, and it's something that takes time to accumulate. Okay, so cigarette smoking is another cause of cholesterol accumulation in the blood vessel.
Mm.
There's sedentary lifestyle. So we encourage people to do exercise. I will
Mm.
still come to the foods that you eat. I'm only emphasizing the ones you should
You
not
should avoid.
eat here. So sedentary lifestyle is the new smoking in town. So it can as well cause cholesterol accumulation in the blood vessel,
Mhm.
especially in the vessels of the heart, because these are tiny vessels. There are other vessels, major vessels, that cholesterol accumulation can occur, but we are talking about the heart today. And
Right.
I know, so we've seen cases in a cath lab where a single vessel is blocked, that will have to put a stent to open it up. We've seen cases where two or the three major vessels are blocked.
Mhm.
In that case, you have to do an open heart surgery to do a bypass in the heart. So it's something that should be taken very seriously, because we've had a lot of cases of sudden deaths in our society, both the high and the mighty, both the low income and high income earners. everybody. Nobody is immune to sudden
Placenta,
cardiac death.
yeah.
Yes. So it's called for serious concern that we should know what we eat and we should always know our numbers. And knowing your number is not just knowing your blood pressure number, also know your cholesterol number because
Okay.
cholesterol has number. So when I say you know your number, I mean know your blood pressure, know your sugar level, and most importantly, know your cholesterol numbers. So in due course, we're going to give the numbers
How it's supposed to
how
be.
it's supposed to be.
Right, that is absolutely interesting. Let's quickly just touch here on the diet itself. We've spoken about foods we should avoid. What are the foods now that we should actually indulge in? And I say indulge, not that you should go overboard. I'm just saying, what are the things we should start having to be a part of our lifestyle to change the trajectory of having our cholesterol high, or something we can, at least try to start now to balance things out.
Yeah, so most importantly, we should eat more of plant-based diet.
Okay.
You know,
Leafy
vegetables and
greens.
fruits, leafy vegetables and fruits.
Mm-hmm.
So I like my kids, I encourage them take one apple to school every day. So it helps you burn down cholesterol because fruits are very, very good. They contain antioxidants that help break down cholesterol. Then when you want to use oil, especially oil used in frying, so we
Right.
advise against saturated oils. We take more of polyunsaturated. What do we mean by saturated oil? So it's the kind of oil when you keep to stand, it sediments
Ah,
and separates.
right,
Yeah, so you know that that
right.
one is a saturated oil.
Mm.
But the polyunsaturated oil is the one that doesn't sediment. So we encourage that you fry with polyunsaturated oil. So very important. Then alcohol consumption. So when you consume excess alcohol, so the body, the liver produces more of LDL cholesterol. And so that will not be healthy for your heart. So we talk about moderation in alcohol ingestion. Then smoking is a no-no. There's no moderation with smoking. So
Mhm.
smoking is cessation of smoking. Okay. So diets, basically our African diets are rich in vegetables, rich in antioxidants. So we kick against going more for fast food, baked food,
Mhm.
that those baked food can actually increase cholesterol content in the body. So the emphasis is on vegetables, on fruits, on consumption of polyunsaturated oil, and if you have option to boil rather than frying, so you boil instead of fry. If you have the
Right.
option of boiling, so it's very important for us. Then most
Mm.
importantly, again, avoid sedentary lifestyle that will lead to obesity. Because with obesity, there will be accumulation of cholesterol, both in the subcutaneous tissue and inside the blood. So
Mm.
lifestyle, very important. Engage more in exercise so that your body mass index will be within the normal limit, because we know that obesity is a potent cause of high cholesterol in the blood.
Mm. Very well said. Thank you so much for expatiating on that, and giving us more insights as to why we need to improve on our diet and the things we need to eat. But here's a myth. I don't know if this is true or if it's something that we need to debunk. I've heard that slim people do not get don't have cholesterol. It's only people who are plus size that only have cholesterol. So how true is that?
Okay, so it's not true. Anybody can have high cholesterol. When we started this program, I said we can have cholesterol in the subcutaneous tissue and in the blood. Okay,
Right.
so slim people simply don't have cholesterol in their subcutaneous tissue. So they can have high cholesterol in the blood. And that is the one we are even more particular. Both can cause heart diseases, but through
Right.
different pathways. Okay, so but the pathway of cholesterol in the blood
Mm.
is accumulation of plaques in the blood vessel, blockage of the blood vessels, and leading to a heart attack or a stroke. So slim people can actually have high cholesterol.
I needed us to get into that because you hear a lot of people say, "Oh, it's only the people who are plus size. That's why they're the only ones that have LDL as opposed to the slim ones. Oh, they can eat anything, and really they do eat anything." they binge eat or and eat a lot of fried food. So don't think because you're on the slim side or you're petite and you think that you're clear. No, that's even worse. You could just be killing yourself without even knowing it. So for someone listening right now who has never done cholesterol check, how often should they be testing and what are the healthy numbers to look out for?
Yeah, so testing for cholesterol now depends on other comorbidities. Now, for someone who has other comorbidities such as hypertension or diabetes,
Right.
so it's advisable that you check your cholesterol level once in 3 months. Okay, so for someone who doesn't have other comorbidities and no family history,
Mhm.
you can check twice a year if you are above 40 years and above. Or if
Right.
you are less than 40, you can check once a year. So it's important you know your numbers. And in knowing your numbers, you should also know that the bad cholesterol, LDL cholesterol, should not be more than 150 for someone who doesn't have a comorbidity.
Okay.
You don't have hypertension,
Yes,
you
you
don't
don't
have
have anything.
diabetes, you don't have family history. The upper limit for the bad cholesterol is 150 milligrams per DL.
Mhm.
So we always want our cholesterol to be less than that. But for someone who has comorbidity, you know, probably the person had a stroke before, or is hypertensive, or
Mhm.
diabetic, or has a family history. So we emphasize that your cholesterol level should be less than 70 so that you be on a safe, you
Be
should be on
safe.
on a safe range, less than
Mhm.
70, unlike someone who doesn't have comorbidity. Then for total cholesterol in the body should not be more than 200 milligrams per DL. Okay, so we advocate that for someone without comorbidity, you should target less than 200. But for someone with comorbidity, your total cholesterol level should be less than 150. Okay, so for high density cholesterol, we advocate that your cholesterol level, your HDL cholesterol should be above 45 milligrams per DL. So when it is high, the higher it is, the more protected your heart. So that's why we say HDL is good cholesterol. Okay, so that's the police of the blood vessel, police of the heart that
Mhm.
helps takes out bad cholesterol, transport them back to the liver, and the liver discharge them from the body.
Right. Right. Okay. So at what point will a doctor decide that it's not just your lifestyle change, you need to include medication?
Yeah, so with knowing these numbers, whenever we have these numbers higher than the normal, okay, we tell you at this point you need to be on medication. Okay. Now, but if you've had a a stroke or a heart failure,
Right.
or you've had diabetes, okay, all these are factors that can lead to, high cholesterol in the body because someone who has a stroke or heart failure may not be able to do exercise, will be more sedentary. So at this point, even when your cholesterol level is normal,
Right.
we'll still tell you to take medications for cholesterol because you have other risk factors, other comorbidities. Okay. But for someone who doesn't have comorbidity, we only advocate lifestyle so that your cholesterol level will not exceed the normal limit. So lifestyle, it's more of preventive. So because that's the most important thing for heart health. Prevention is far, far better than cure. Because when you prevent heart diseases, you prevent cholesterol plaque accumulating in your vessel. You won't stand a chance of getting a heart attack or a stroke. So, but whenever it exceeds 150 milligram for the LDL cholesterol, we'll start you on medication. And starting you on medication does not preclude lifestyle. So they go concurrently. So both your lifestyle and the medication, they go concurrently. So it helps it. Not, you see people do exercise.
And
After the
then
exercise, they're taking soda, they're taking meat pie, they see they're tired, they want to replace energy. What you
right.
just burnt out, you are
You're
bringing it,
taking it
you're
back
taking it
in.
back again. So lifestyle with medication, they go concurrently.
Okay. Finally, we have come to the end of the session. But before I go, or if I let you go, rather, what are three practical everyday things an average Lagosian should start doing right now to protect their heart health?
Yeah, so practical things average Lagosians should do. First of all, manage stress. So when you manage stress very well, because stress has been shown to increase hormones that can stimulate production of cholesterol.
Okay.
So if you manage stress very well, it will help put your cholesterol level down.
Okay. Okay.
Two, another practical thing you need to do is to eat a fruit a day. Ensure that you
Okay.
take a fruit a day, whether apple, whether cucumber, whether orange,
Watermelon. As long as
watermelon.
it's
Yeah,
fruit.
yeah. So just take a fruit a day. So it helps,
Balance.
balance cholesterol level. Then
Wow.
finally, activity,
Mm.
exercise. Incorporate exercise into your everyday life. So I tell people, don't skip a day for exercise. No, I'll do exercise when I come back from work. I'll do it over the weekend. Activities will come and take up your time. So how do you incorporate it in your everyday life? When you go to work and you walk on a four-story building, instead of taking the elevator, you can climb the staircase. So it's a practical way of burning fat and reducing cholesterol. When you get home, you park your car and you want to do anything around the house, the neighborhood, instead of opening the gate and you're driving out, you just walk down. So if you get to work, you park your car a little distance from your place of work so that you can walk. So we encourage walking. So taking 10,000 steps in a day will help reduce cholesterol, will help your heart to function better. So these are the three practical steps I will encourage Lagosians to take.
All right. Well, thank you so much, Dr. Francis, for sharing those insights. And I'm sure that Lagos has learned a lot. I have actually, now that I know that as much as, yes, I enjoy eating fruit a lot, but now I know that I need to up it and then increase my veggies as well. But hey, that's for me. I'm hoping that you're also taking that into cognizance as well, Lagos. So how can Lagos reach out to you? Social media handle, if they have further questions or need more insights.
Okay, so if you have further questions or you need more insight, you can reach us at Iwosan Lagoon Hospitals. We're at Ikoyi, 17 Bodilon Road, Ikoyi. We're also at Legalia Yorinde, 3B Legalia Yorinde, Fairback Center, Victoria Island. We're
Right.
also at Keja, at Awolowo Road, and Adeni Jones. Well, I personally am at 17B Bodilon Road, Ikoyi. So if you want to reach us, just reach out to us at Ikoyi. You will have your heart checked, you will have your cardiac services, and you will be healthier.
All right. Thank you so much.